I grew up skiing. Being from Massachusetts, that's kind of what we do, but I stopped when I got to college, and I didn't ski again until I met Jim. My first meeting with Dr. Tifford was indeed caused by skiing. It was more specifically caused by me being too competitive and trying to keep up with my husband, who skis at speeds that no intermediate skier such as myself should really be skiing at.
And the next trail in sequence was probably the steepest trail on the mountain where they did all the race training. Next thing I know, she's strayed to the side and hit the ruts where the racers had been, flipped around, and is on her back sliding down the hill with her ski flopping back and forth from one side to the other.
The injury was an ACL tear right knee with some other damage inside the knee, some meniscus, some cartilage, but it was ugly.
I first met Liz about 14 to 15 years ago. She had sustained an ACL tear. She underwent an operation at that time. She rehabbed it very, very well, and then I didn't see her for a whole number of years. And then she came back to the Long Ridge Medical Center about a year and a half ago, having injured her other knee, also in a skiing accident.
Dr. Tifford was super committed to getting me back to a level of activity that I wanted and to not limiting what I could do. That's why I knew he was the right fit.
So here at Yale Medicine Orthopedics at Greenwich Hospital, the way that I do this operation, or this all-inside, very, very minimally invasive ACL reconstruction, is through 3 very, very small cuts, each maybe about 1/4, 3/8 of an inch around the knee. And so this is a model of a right knee, and if we look at the inside of the knee, this is the ACL, or the anterior cruciate ligament here. So this stabilizes the end of the femur to the top of the shin bone, or the tibia bone, and the ACL prevents the tibia bone from coming forward like that. So when the ACL is torn and patients plant the foot and pivot to the side, the sensation they get, the buckling or giving way, is when the tibia is actually subluxing or coming out from underneath of the femur bone.
I was confident that Dr. Tifford could fix me up and return me to the level of activity that I wanted to be at, because he really cared about what I cared about. He cared about giving me the mobility and getting me back on the slopes and getting me back to running and doing all the things I love to do.
Everything is essentially under one roof. They can come in, they can see a doctor in a number of different specialties. All their imaging can be done here: ultrasound, X-ray, MRI, CT scan. Then they can come back and they can see their physician. They can do their physical therapy here, their occupational therapy here, all under one roof. Elizabeth's experience was great. Her operation went flawlessly. She was doing fantastically. She's back to skiing out west multiple days a year and really doing everything that she wants to be doing.
I can't believe I'm standing here on skis about to perform better than I ever have. I'm really feeling like a comeback kid. 'Cause in the end